Signal number 6, premature hair loss. When you notice premature hair thinning and a receding hairline, your body is experiencing follicular regression, a direct cellular marker of accelerated biological aging. This regression is driven by chronic oxidative stress, where an accumulation of reactive oxygen species overloads your scalp tissues. This oxidative burden directly damages the DNA and mitochondria within your hair follicle stem cells. Lacking cellular energy, these stem cells fail to signal for new growth, causing the follicles to shrink, shorten their active phase, and prematurely degenerate into dormant, non-functioning structures. To reverse this regression and restore density, you must neutralize oxidative damage and reactivate your dormant follicles. You can apply topical antioxidants, such as melatonin or copper peptides, to neutralize free radicals and protect stem cell viability from further oxidative exhaustion. To stimulate active regeneration, utilizing microneedling or low-level laser therapy creates controlled microinjuries that activate the critical WNT beta-catenin signaling pathway, forcing dormant stem cells to wake up and rebuild the follicle matrix. Finally, introducing a vasodilator like minoxidil increases local blood flow, restoring the oxygen and nutrient delivery required to completely halt regression and push your follicles back into a prolonged growth cycle. Signal number 5. Visceral fat accumulation. When you notice your waistline expanding and your abdomen becoming firm, you are experiencing a drastic shift in fat distribution, which is a critical marker of accelerated biological aging. Over time, your body loses its capacity to safely store lipids within the subcutaneous tissue directly beneath your skin, redirecting them instead into the abdominal cavity to envelop your vital organs. This dangerous shift is directly driven by the development of insulin resistance. As your cells become desensitized to this hormone, your pancreas pumps out excessive insulin to compensate, a state that completely blocks your ability to burn fat and forces your body to chronically convert excess energy into visceral storage. This deep tissue functions as a dysfunctional endocrine organ, destroying your metabolic flexibility and accelerating systemic cellular decay. To reverse this shift in fat distribution and restore your insulin sensitivity, you must implement protocols that reduce your metabolic hormone burden. Eliminating refined carbohydrates and added sugars from your diet will lower your basal insulin levels, allowing your body to finally access and mobilize deep visceral deposits for fuel. Combining this nutritional change with progressive resistance training and high-intensity intervals stimulates the release of catecholamines, which are hormones that preferentially mobilize abdominal fat. Finally, optimizing your sleep architecture and mitigating chronic psychological stress will reduce your cortisol production, preventing this hormone from signaling your body to preferentially store new lipids in the visceral compartment. Signal number 4, circadian rhythm disruptions. When you experience fragmented sleep or wake up chronically exhausted, your body is suffering from an age-accelerating decline in melatonin and severely impaired sleep architecture. Melatonin is not just a sleep signal, it is a powerful antioxidant hormone that coordinates cellular cleanup. As its nocturnal production drops, your body fails to transition into deep, slow-wave sleep and rapid eye movement stages. This structural breakdown of your sleep architecture halts mitophagy, which is the necessary clearance of damaged mitochondria and prevents crucial DNA repair. Without these deep regenerative phases, cellular waste accumulates across your tissues, rapidly advancing your biological age. To reverse this disruption and rebuild your sleep architecture, you must strictly optimize your light exposure and thermal timing. Begin by exposing your eyes to 10 to 15 minutes of direct, unfiltered sunlight within 30 minutes of waking to anchor your master clock and optimize your morning cortisol surge. In the evening, eliminate all artificial blue light for at least 2 hours before bed by utilizing amber blocking lenses or low-lux lighting to allow your natural melatonin surge to occur. Finally, maintain a cool sleeping environment below 67 degrees Fahrenheit to trigger the core body temperature drop required to plunge you into deep, restorative slow-wave sleep. Signal number 3, skin inflammation. When you notice persistent facial redness, chronic irritation, or a premature loss of elasticity, your skin is undergoing inflammaging, a state of chronic, low-grade inflammation that accelerates biological tissue decay. This degradation occurs because inflammatory signaling molecules actively break down collagen and elastin, the vital structural proteins that keep your skin firm and resilient. This process damages your dermal fibroblasts, which are the cells responsible for skin regeneration and repair. As a result, your skin barrier becomes compromised, cellular turnover stalls, and your tissues experience accelerated wrinkling, thinning, and structural sagging. To reverse skin inflammation and rebuild your dermal matrix, you must neutralize these inflammatory cascades and stimulate cellular repair. You can apply topical retinoids or bakuchiol to accelerate your skin's cellular turnover rate and force damaged fibroblasts to synthesize new, healthy collagen. To protect this new matrix, apply potent topical antioxidants like stabilized vitamin C or niacinamide to reinforce your skin barrier and neutralize environmental free radicals. Finally, eliminate high glycemic foods from your diet, such as white bread, sugary pastries, and processed cereals, to stop the formation of advanced glycation end products, which are destructive compounds that stiffen skin proteins and accelerate visible aging. Signal number 2, persistent exhaustion. When you experience persistent exhaustion that sleep cannot fix, your cells are signaling a profound decline in mitochondrial function, a core hallmark of accelerated biological aging. Your mitochondria are the cellular powerhouses responsible for generating adenosine triphosphate, or ATP, which is the primary energy currency your body requires to function. As biological aging accelerates, these powerhouses become structurally damaged and inefficient, drastically dropping their total ATP output. This energetic deficit starves your vital organs and muscles, trapping your body in a state of chronic systemic fatigue due to a lack of baseline cellular fuel. To reverse this decline and ramp up your ATP production, you must stimulate mitochondrial biogenesis, which is the creation of new, efficient cellular powerhouses. You can achieve this by performing Zone 2 cardiovascular exercise, such as sustained brisk walking or cycling, which gently stresses your cells to force the expansion of your mitochondrial network. Finally, practicing targeted cold exposure or short fasts triggers mitophagy, clearing out worn-out mitochondria to make room for high-performing, energy-dense structures. Signal number 1, brain fog and memory loss. When you experience mental cloudiness or short-term memory decline, your brain is suffering from a loss of synaptic plasticity, its ability to forge new connections. This decay is directly caused when chronic psychological stress or poor metabolic health chronically elevates your cortisol levels, which overactivates your brain's resident immune cells, called microglia. Instead of protecting you, these hyperactive cells trigger persistent neuroinflammation that actively prunes and destroys healthy synapses, while a parallel drop in brain-derived neurotrophic factor deprives your neurons of the vital growth signals needed to repair this structural damage. To reverse this decay and restore your synaptic plasticity, you must trigger neural growth and flush out these cellular stressors. To halt the neuroinflammation, optimize your deep sleep to activate your glymphatic system, a nightly waste clearance mechanism that vacuums out the neurotoxic debris causing microglial overactivation. Finally, supplement with high-dose omega-3 fatty acids, specifically DHA, to provide the essential structural lipids needed to rebuild and insulate your damaged neural membranes.